Hello everyone, welcome to my YouTube channel. Today's topic will be ectopic pregnancy. These are the objectives for this video. What is an ectopic pregnancy? This is where I will be explaining the definition and in a simple term for you to understand. And what are the types of ectopic pregnancies? What are the signs and symptoms? How can you see that you may be having this type of this type of pregnancy? Then the last one will be, how is it treated? That the fact that now you are diagnosed that you are having ectopic pregnancy, then what is the next thing that the healthcare worker or the doctor can do to treat this type of pregnancy? Right. The first question, what is an ectopic pregnancy? Then this is the pregnancy in which the fertilized egg implants outside the uterus. All right. Look at this picture that is here on this slide. This is the fallopian tube. The whole of this is a fallopian tube. This is the egg that I am talking about. If I'm saying that the fertilized egg implants itself outside the uterus, you can see that it is labeled here. This is the uterus. The whole of it is a uterus. In the normal circumstance, the pregnancy should develop here so that the fetus or the embryo can develop to fetus and occupy the space. It should implant itself here on this side. So whenever it happens here, then that is leading to this type of pregnancy called ectopic. So in this pregnancy, the egg cannot develop or grow up to a fetus stage. If the egg is not removed, now we say that the egg has developed outside of the uterus. Then if this egg does not develop, if this egg is not removed, it will grow. And when this egg grows here, I'm highlighting in green now. So when this egg develops in this area, then what will happen? It will damage this tube. This is the fallopian tube. It will damage it because it's not meant to be enlarged this much. So once it ruptures, we use the term rupture. It will be damaged and it will rupture. And when it ruptures, there will be blood that is bleeding inside the woman. And when this blood is shedding or is bleeding, then there will be the blood loss in the body. And what will happen? It will lead to complications that we know as anemia. So, and a person can end up dying due to this complication. All right, let's go to the next question. The next question, what are the types of ectopic pregnancies? All right, in this video or in this today's video, we will focus only on the one type of ectopic pregnancy. Okay, this says that ectopic pregnancy is also called extrauterine pregnancy, meaning that it develops outside the uterus, as I've shown you in the previous slide. So the common one, the most common one, maybe you may know someone that has had this before. It's called a tubal ectopic pregnancy. Tubal ectopic pregnancy is the one that I just showed you. Tubal means that the tube. Ectopic still means that the egg has developed in a tube. That tube is called a fallopian tube. So it develops on that tube. Some ectopic pregnancies can happen in the ovaries, the cervix, the interstitial. This interstitial is also called, aka means also known as cornual. The other one is hysterectomy, which is a cesarean scar and abdominal. The cesarean scar means that when you had the cesarean delivery previously, the C-section, then there is a chance, not that everyone have this, but there is a chance that you may develop the ectopic pregnancy in your next pregnancy. Then they can also be abdominal. So all these are saying that the baby or the fetus or the egg can develop in anywhere beside the uterus. That's what it says. But the common one that happens is the tubal. Is the tubal. Remember that the egg, when the sperm enters, it goes to the fallopian tube, and that is where it meets with the egg, and that is where it hatches and starts developing. Then it's rolled to the uterus to form the embryo, then it's developed to be a fetus. What are the signs and symptoms? How can you see that you may be? What are the things that you should be aware of so that you can say that you're suspecting ectopic pregnancy? The common types of symptoms or the common symptoms is they say that in the first trimester, meaning that the first 3 months, within the first 3 months, there will be vaginal bleeding. This vaginal bleeding, remember that you need to first have done what we call pregnancy test. Then all these, they follow after this pregnancy test. Then you also have what? Abdominal pains. The pregnancy test said positive. It is rare whereby a person will be having ectopic pregnancy but still be having negative pregnancy test. It's sometimes happen, but it's rare. Commonly, the pregnancy test will say positive. Then you will have what you call vaginal bleeding, and you'll have abdominal pains. So these symptoms, you'll notice them in the first 3 months. So they say that normal pregnancy symptoms such as breast tenderness, nausea, frequent urination, the normal symptoms, others call it morning sicknesses. So you may feel them, but sometimes you may not feel them, because the reason you feel those morning sicknesses is because of the hormones that are increased. But sometimes the hormones will not be increased in the body. Therefore, you may not feel these symptoms such as the breast. When you touch your breast, you'll even feel that they are big, and when you touch them, they are bouncing back, meaning that they are tender. There is nausea. You feel like vomiting. You start hating certain smells that you never had problem with, and your appetite also may be impaired. Frequent urination, you'll feel the urge or the need to pee now and then. Then there will also be pains that may be felt in your shoulders. Whenever you're having ectopic pregnancy, you may feel the pains on the shoulder. Why do you feel the pains in the shoulder? After bleeding, the internal bleeding, when there is blood, this blood, remember, it will go anywhere around the stomach. Okay, you call it the stomach, but the right term is the abdomen, the whole part that commonly people will say is the stomach. So when there's blood leaking over there, then it will come up to this part called diaphragm, and the diaphragm is in contact with the shoulders. So that's why this blood coming out is now causing pain to the other parts of the body. Then there will be an urge to defecate. Defecate means going to do number 2 or to pass stools. So it depends how you call it. Why do you feel the urge to defecate or to go to the toilet to do number 2? It is because the uterus is in line, or they are attached against the rectum, or I don't know, you can say maybe the pipe for feces. So when there is blood that has leaked to that side, then you'll continuously feel the urge to pee. Sometimes it can be the fact that the ectopic pregnancy or the egg has developed to a certain size. Now it's pressing on the rectum. Therefore, you'll feel the urge to defecate. The symptoms normally appears from 6 to 8 weeks from the last day of your menstruation. So if you're counting from the day you last had your menses, then that is when you'll see that, I mean, you'll count 6 to 8 weeks, then that is when you start to be aware that you might be having this ectopic pregnancy. Okay, the next one, how is it treated? An early ectopic pregnancy is treated by medication. This medication is called methotrexate. So you don't need to try to go to the shop and buy this. You're not going to get it in any pharmacy. I mean, it's not an over-the-counter type of medication that you can just go buy. So it is given by injection by the qualified personnel. Then this medication, you'll be injected, then it will destroy those cells in the fallopian tube. It will destroy them, then they will be absorbed in the body, then that's it. Simple like that. Then you will be fine. Laparoscopic procedures, there's the one called salpingostomy, which here they just remove that ectopic pregnancy. They will just remove that egg, and after removing that egg, remember that they just cut a little cut, then they will put something with like sort of a camera with the lens, then they will just remove that egg that is developing, then they will leave the fallopian tube to heal by itself. The other one is called salpingectomy. This one, they will remove both the ectopic pregnancy, that's egg developing there, then they will also remove the fallopian tube. Remember that you got 2 fallopian tubes, so they will remove one, then it means that you still have another one for the next pregnancy if you still wish to. Excuse me. Then on this, it is said that once you have one ectopic pregnancy, there are many chances for you to have another one next time. So it is very important to be alert and always be aware. And it is very important for you to note that ectopic pregnancy is fatal. It can lead to death if it's not treated early, because there will be blood, that they call it hemorrhage. There will be bleeding that is happening inside. You will be continuously having menstruation. You will think that this is menstruation, whereas it will be this damage happening inside your uterus or the organs next to uterus, and you'll start having the pelvic pains at the back or the front, the lower back, below your belly button. So you'll start feeling all these pains and you're not aware that you are having ectopic pregnancy. So you need to really take this very serious, because people do die because of this. So whenever you suspect this, go to the clinic. Whenever you feel like you are not helped very well, you can go to any doctor and get helped. And the person, before you get, they will test you with everything. You do the pregnancy test, you will go to ultrasound, they check the baby or the fetus, whether you're really pregnant, they calculate for you how many weeks and stuff like that. There are a whole lot of things that are done, but here I was just giving the insight in simple terms for you to understand. We say that this is when the egg develops outside the uterus, of which it does not develop where it should be. And when it's developed in that tube, fallopian tube, it will grow and it will damage the fallopian tube. Then there will be blood leaking to other organs and you lose blood. When you lose blood, that blood will become poisonous or toxic to your body, and it may even lead to pains on your shoulders, and this will also damage other organs inside your abdomen, and this will also cause infection, lead to anemia, and it will also lead to death, and you die only to find that you were acting strong, you didn't want to go to seek for medical help. Thank you so much for watching this video. Please do like this video and subscribe. I will continue make more videos on relevant topics to educate you and your friends and everyone else. Thank you so much for watching. I appreciate